I think one outcome from the study that would surprise oncologists is the issue of total spending. So again, I think that there's this narrative out there that cancer costs increase at a rate that's disproportionate to total healthcare costs. And I think that that is not a fact-based statement. When we looked at patients treated with acute cancer and patients who had a history of cancer but didn't have an acute cancer, their costs rose at the same rate as total healthcare spending. And so I think that that's one thing that will surprise people because it's different than what's been out there in the media, that cancer costs, in fact, are proportional to increases in total healthcare costs. I think another thing that would surprise oncologists is the cost difference attributable to site of service shifts. So one of the third portion of the study, with the first portion looking at total cost of care and total prevalence of cancer, the second portion looking categorically at type of spending and by disease type, and the third portion looking at site of service shift, we see that there's been a tremendous site of service shift over the last 11 years by about 40% in both the Medicare and the commercial patient population from 2004 to 2014. This means that community oncology practices, physician practices, have either closed or shifted to the hospital outpatient department because more and more services are rendered in the hospital outpatient department, and about 40% more than a decade ago. So I think that that's a surprise. The second portion that we looked at in that site of service and those site of service differences and what we could attribute to site of service change was to look at total cost by site of service to understand to what degree that was a contributor to the cost of care. And what we saw is that in some cases there was upwards of a 30% change in the cost of care by site of service. That's a really large amount of spending just by site of service shifts. And in fact, there was one portion of the study where we looked at the services provided in 2014 and the total costs in 2014, and applied those services to the site of service distribution in 2004, so 11 years earlier, when there were 40% more community practices, and looked at that delta for 2014, and it was $2 billion. So $2 billion of spending attributable only to site of service changes over that 11-year period. I think that's shocking. As we today in the United States spend about 18% of our gross domestic product on healthcare, and we know that a lot of that represents innovation, but it's a high number to spend, and we seek to control costs. To have costs attributable simply by site of service doesn't seem like that's a useful way to allocate limited resources.